All right, today we're talking about something that honestly sounds like it's straight out of science fiction. LASIK. We're going to break down how this incredible laser eye surgery actually works and how it's giving millions of people the chance to see perfectly without any help.
I mean, really think about that for a second. How can a simple beam of light completely fix your eyesight? It sounds kind of like magic, right? Well, let's pull back the curtain and see exactly how this amazing trick is done.
But before we get into the high-tech laser stuff, we've got to understand the problem it's trying to solve. I mean, why do so many of us even need glasses or contacts to begin with?
Well, the whole reason your vision might be blurry boils down to something called a refractive error. Now, that sounds super complicated, but it's not. It just means that the shape of your cornea, that clear dome at the very front of your eye, isn't quite perfect.
So in an eye with perfect vision, the cornea has the ideal shape. It acts like a perfect lens, bending light rays so they focus right onto a single spot on the retina at the back of your eye. A great way to think about it is like a movie projector. When it's perfectly focused, you get a sharp, crisp image on the screen. Same idea here.
But even a tiny change in that shape can cause a huge problem. Take nearsightedness, also called myopia. In this case, the cornea is a little too curved, too much like a dome. This extra curve bends the light too sharply, so the focus point lands in front of the retina instead of on it. And what does that mean for you? Well, you can see things up close just fine, but everything in the distance turns into a blurry mess.
And you guessed it, farsightedness, or hyperopia, is the exact opposite. This time, the cornea is too flat. It doesn't have enough curve to bend the light properly, so the focus point ends up behind the retina. That's why if you're farsighted, you might be able to read a sign across the street perfectly, but a book in your hands is all fuzzy.
Okay, so then you have astigmatism, which is kind of a mix of problems. Instead of the cornea being a nice, perfect sphere, it's shaped more like a football or an egg. It's irregular, and because of that weird shape, light scatters all over the place inside your eye instead of focusing on one spot. The result? Blurry vision at pretty much all distances, near and far. So there you have it. Nearsighted, farsighted, astigmatism, they're all problems with the shape of the cornea. And that leads to a really elegant solution. If the shape is the problem, well, why not just fix the shape? And that right there is the entire idea behind LASIK.
Yeah, LASIK stands for a super long technical name, but you don't need to remember that. What you do need to know is what it does. It uses an incredibly precise ultraviolet laser to literally reshape your cornea, permanently fixing those refractive errors we just talked about.
So how does it actually do that? Well, let's take that nearsighted person with the cornea that's too dome-shaped. The laser targets the very center of it. By vaporizing a microscopic layer of tissue, it actually flattens that dome out just enough so light can finally focus right where it's supposed to, on the retina.
And for someone who's farsighted, they do the complete opposite. Remember, their cornea is too flat, so the laser works on the outer edges of the cornea. By removing tissue from the periphery, it makes the central part effectively steeper. It's like it's building up the curve that was missing.
For astigmatism, the laser's job is even more impressive. It's like a microscopic sculptor. It goes in and smooths out all those irregular bumps and valleys on that football-shaped cornea, carefully turning it back into a nice, round sphere. This lets the light focus on a single, crisp point again.
Okay, so that's the theory. But what's it actually like to go through the procedure? This is where things get really wild. You'd think something this precise would take hours, right? Nope. The whole thing, for both eyes, is usually over in less than half an hour.
It really breaks down into 4 simple steps. First, they numb your eye. No needles, just drops. Second, they create a tiny flap on your cornea. Third is the main event. The laser does its reshaping work. And finally, they just lay that flap right back down. So that first big step, creating the flap, is key. The surgeon uses this amazing little tool, a microkeratome, to create a super thin, hinged flap in the top layer of the cornea. Think of it like carefully opening the cover of a book. They gently lift it up, and that gives the laser a clear shot at the tissue right underneath. All right, now for the laser itself. This isn't like a laser in a sci-fi movie that cuts things. It's a cool, ultraviolet laser that actually vaporizes microscopic bits of tissue. It's a process called ablation. And that slight burning smell people sometimes notice? It's totally normal. It's just the carbon atoms from that tissue being released into the air. And just like that, I'm talking seconds of laser time per eye, the reshaping is done. The hardest part is over. So, what happens then? What's life like on the other side?
This part is incredible. The surgeon just puts the flap back down. That's it. No stitches, no glue, nothing. The cornea is an amazing part of the body. It has this natural suction that pulls the flap back into place, and it starts healing immediately. The flap literally becomes its own perfect natural bandage. And the results? They speak for themselves. A whopping 96% of patients get the vision they were hoping for. 96%. For almost everyone who gets it done, that means saying goodbye to glasses and contacts for good. No more fumbling for glasses in the morning or dealing with dry contacts.
When you see a number like that, it really makes you think, doesn't it? We have this technology that uses a beam of light to reshape the very lens we see the world through. It kind of forces you to wonder, are we looking at a future where glasses and contacts are just artifacts in a museum?